Hi everyone, I'm Dr. Ila Jain Khandelwal and I'm back again with the next module on hematology images students, and in this module we are going to discuss the images from red blood cells as well as a few miscellaneous images, right? I promise you people students that the images which we are going to do in this module are extremely important for all the MCQ exams, whether it is INI-CET, NEET or FMGE, right? So just before your MCQ exams, whenever you are revising images or pathology, please go through this module or all these images, right? So let us start with the first with the images students. In this section, we are going to discuss the RBC abnormalities on a peripheral smear, right? So when a pathologist sees a peripheral smear, what are the things which I can see in the RBCs, right? First of all, let us see this image, students. In this image, can you appreciate these red blood cells which are here, these RBCs? Do you think these RBCs are normal? Whenever I draw normal RBC, it is like this. It has a central one-third pallor. Can you see any pallor in these RBCs? Notice all of these RBCs. I don't see any pallor, right? They are consistently pink or purplish, whatever color, right? So there is no pallor. And also see there is a reduction in the size and they are quite rounded, right? So that is why, what are these cell students? These are called as the spherocytes, right? Where will you see spherocytes? On a peripheral smear. So whenever I see spherocytes, I have to think of four things in the DD. Hereditary spherocytosis, autoimmune hemolytic anemia, burns, and blood transfusion reaction, right? Now, if the examiner asks you what is the most common cause of spherocytosis on a peripheral smear, the answer is not going to be hereditary spherocytosis, but it is going to be autoimmune hemolytic anemia. It is the most common cause of autoimmune hemolytic, autoimmune hemolytic anemia is the most common cause of spherocytosis on a peripheral smear. Understood? The answer is not hereditary spherocytosis, right? Sometimes the examiner can give this kind of a peripheral smear and ask you what kind of a test will you do. So you will do both the osmotic fragility test and also the Coombs test. If the Coombs test is positive, I'll go towards the diagnosis of AIHA, and if the osmotic fragility test is positive, I'll go towards the diagnosis of hereditary spherocytosis. Understood? Easy? Okay, let's move to the next slide. Very interesting, students. These are the normal RBCs. Now, I hope you can compare them with the spherocyte. These have a central pallor and that is 1/3 approximately, right? Can you appreciate this RBC, students? Don't you think it appears as if somebody has come and bitten off this RBC, right? That is why these are called as the bite cells. Somebody has bitten off these RBCs, right? And also, students, when we do a vital stain on them, the vital stain is brilliant crescent blue or new methylene blue. What we see are Heinz bodies, right? If the examiner asks you, bite cells and Heinz bodies are seen in, answer is G6PD deficiency, right? So the peripheral smear questions can come in various forms. Either they can directly ask you a question, bite cells are seen in which disorder? These kinds of questions were asked in past 4-5 years, right? Now a clinico-pathologic question is mostly asked. They can give you a history of a patient with jaundice, hemoglobinuria. They can give this kind of a peripheral smear and ask you what is the most likely diagnosis. Understood? Right? The important take-home point here is that Heinz bodies are not seen on Romanowski stain. Heinz bodies are seen on the vital stains, but these bite cells are seen on the Romanowski stains. Understood? Okay. Next one. Okay, very easy. I feel this is one of the simplest peripheral smear finding which you see. Can you people appreciate these cells, students? These ones, right? Don't you think they look like a sickle? The sickle which the people use, right? So that is why these cells are called as the sickle cells and they are seen in sickle cell anemia, right? So there can be a history of a child with jaundice, with splenomegaly and gallstones, and they can give any of the history of crisis like bone pains or osteomyelitis or any of the crisis, or there is increased risk of infections, right? And they can ask you, they can give you this peripheral smear and ask you the diagnosis, or very commonly they ask you the pathogenesis of this condition. What is the pathogenesis of sickle cell anemia? Missense point mutation, in which glutamic acid is replaced by valine at the 6th position of beta chain of hemoglobin. Understood? Okay, next. Okay, can you see these are the RBCs normally which you see, but look at this cell. Do you think this is a normal cell? This cell? I don't think so. It looks like a target. Remember in childhood we used to play the game of darts, right? So this was the dart, and then there used to be a target in which you have to hit the dart, right? So don't you think it looks like that? This cell also. So these are the target cells. It looks like a target, right? And they are seen in thalassemia, liver disease, or megaloblastic anemia. Thalassemia is one of the most common causes of these target cells, and thalassemia will also show microcytic hypochromic RBCs, smaller and less color. Correct? Next. Okay, what do you see in this image, students? Can you see the RBC has got bluish dots inside it, right? This is called as basophilic stippling, the RBC with bluish dots. Basophilic means bluish, right? So RBC has got bluish dots. So this is called as basophilic stippling, which is characteristic feature of lead poisoning, also seen in thalassemia. And can you see this cell, students? Don't you think it looks like a teardrop, right? Drop of a tear, right? That is why it is called as a teardrop cell, and a teardrop cell is seen in myelofibrosis. Suppose this is the bone, students, and the bone has got a lot of fibrosis, right? These are the RBCs which are there. Now the RBC has to go through this fibrotic bone marrow, right? Bone. When the RBC passes through, it does not have any space, so it becomes like this. This is called as a teardrop cell, and teardrop cell is seen in myelofibrosis, or another answer can be myelodysplastic syndrome. Two answers, right? What will be the bone marrow aspirate of myelofibrosis? Of course, there is a dry tap. Bone marrow biopsy will show black colored reticulin stain, right? Next, in this image, can you people see these cells? Now, the RBC has got some projections, and the projections are also blunt like this. So that is called as a Burr cell, right? Cell with blunt projections, that is called as a Burr cell. And, I'm sorry, here, can you people notice that the RBC has got pointed projections, right? That is called as a acanthocyte. So Burr cell is seen in uremia or chronic renal failure, whereas acanthocyte is a characteristic feature of A beta lipoproteinemia. Another, these are one-liners which are usually asked, right? Next, this is a RBC, and this has got a bluish inclusion. Can you people notice? It has got a bluish inclusion like this, right? These bodies which are seen, these are called as the Haematology bodies. And these Haematology bodies are nuclear remnants, students. They are the remnants of nucleus. And they are usually seen in post-splenectomy. If you take out the spleen of a patient, right, what you see in the RBCs are these remnants of nucleus, and these are called as the Haematology bodies. They are also seen in megaloblastic anemia and thalassemia, right? So they are seen in all these conditions, right? Next. Okay, what are these cells which you see? Come on. Don't you think they look like a helmet? Somebody has worn a helmet, right? That is why they are called as the helmet cells. Also called as fragmented red cells or schistiocytes, right? So schistiocytes, also called as helmet cells, and fragmented red cells are seen in microangiopathic hemolytic anemias like HUS, TTP, DIC, and prosthetic cardiac wall. So sometimes there can be a history of a patient with damaged aortic valve, and they might say that the aortic valve has been replaced by an artificial valve. The peripheral smear is given below. What is the finding which you see? Correct, easy. So all cases of prosthetic cardiac valves or microangiopathic hemolytic anemias will show this finding. Correct. Okay, this image is a spotter which is quite commonly asked in FMGE exam students. Inside the RBC, can you see something like a figure of 8 arrangement? Right? So this figure of 8, which is composed of microtubules, is seen in megaloblastic anemia due to vitamin B12 deficiency mostly, right? And also seen in thalassemia. Best answer is megaloblastic anemia due to B12 deficiency. Easy? Next. Okay, this image, again I'm recapping. Can you see these RBCs? Don't you think these RBCs are a bit abnormal? Compare it with this RBC and this RBC. Can you see this RBC looks normal, but in this there is more than 1/3 pallor. It is quite empty, right? Quite empty. Correct? That is why this is a microcytic, smaller RBC. Hypochromic means more than 1/3 pallor. So microcytic hypochromic RBCs, as I repeat again and again, they are seen in Sita, sideroblastic anemia, iron deficiency anemia, thalassemia, and anemia of chronic disease. Also in the exams, make sure you see that the MCV is less than 80 femtoliters. So if the examiner says that the MCV is less than 80, I mean around 60, 65, and gives an image like this, you start thinking in terms of these 4 DDs, right? In these 4 also students, in anemia of chronic disease, you will mostly see normocytic normochromic anemia. Sometimes you can see microcytic hypochromic anemia. Correct? In contrast, if you see this cell, students, can you see these cells? What it looks like? Don't you think it looks like this pen or a pencil? So these are called as a pencil cells. They are also seen in iron deficiency anemia. So if I ask you 2 things, what is the peripheral smear finding in a patient with iron deficiency anemia? It will be microcytic hypochromic red cells and pencil cells. Correct? Next. Okay, now sometimes the examiner gives you these images of the palms or the hands or the facial mucosa, right? Now in this hand, can you people notice these nails which are there, right? Don't you think there is a depression in these nails? They are spoon-shaped nails, right? This is called as koilonychia, and this koilonychia is seen in iron deficiency anemia, correct? Next. Okay. Now, see this peripheral smear in comparison to this peripheral smear. These were smaller and hypochromic, and in contrast, look at these cells. Don't you think they are bigger cells with no hypochromia, and some of them will be oval also. So what are these cells, students? These are macroovalocytes, macrocytic cells, larger oval cells, right? And this neutrophil which you see here, it is a hypersegmented neutrophil. Let us count the number of lobes. 1, 2, 3, 4, 5, 6, 7, 8. 8 lobes. Any neutrophil with more than 5 lobes or equal to 5 lobes is called as a with more than 5 lobes, is called as a hypersegmented neutrophil, right? Now, this neutrophil has 8 lobes. So, this is a hypersegmented neutrophil, right? And they are seen when megaloblastic anemia due to vitamin B12 deficiency. Easy? Okay. Next one. See a better picture of a hypersegmented neutrophil. Let us count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 lobes. Correct? Next. Okay. Sometimes the examiner can give you an image of a skull, right? X-ray of skull, if it is given, students, it can be, and if the patient has anemia, it can be 2 things. Either it can be sickle cell anemia or thalassemia, and the appearance is called as a crew cut or hair on end appearance. Can you appreciate? Because of extramedullary hematopoiesis occurring in the skull bones, there it appears a spiky appearance. It gives a spiky appearance. This is called as a crew cut or a hair on end appearance, seen in thalassemia and sickle cell anemia. Thalassemia is of course the most common cause, right? Next. Okay, see the nails in this patient. This image has also been asked in one of the exams, so can come in your exams also. The nails look normal. There is no spooning, right? But look at the knuckles. Can you see the darkish pigmentation of the knuckles? These pigmented knuckles are seen in megaloblastic anemia due to vitamin B12 deficiency. Easy? Okay. Next image. What is this, students? These are the RBCs which are there, and this what I see here is the gametocyte of Plasmodium falciparum, another spotter which can be asked in the exams, or they can give a history of a patient with fever, with chills and rigors. Splenomegaly is also seen, and the peripheral smear is here. What is the diagnosis? It is Plasmodium falciparum malaria, right? Next, here, what do you see? Can you see a ring-like thing inside the RBC? So this is a ring form of malaria, right? Next. Okay, this is one of my favorite slides because this is very popularly asked in the question papers, and a very popular question which can be used in any of the papers, right? If they give you this kind of a staining, this is usually a supravital staining which we do for a reticulocyte. Can you see these rounded structures with nothing inside them, nothing greenish inside them? These rounded structures are the RBCs, right? In these RBCs, can you see some meshwork which is there? This meshwork, students, is composed of RNA or histones, and these cells which you see, these are the reticulocytes. So these are mature RBCs, and these with something in them, they are reticulocytes. When the examiner is going to give a blue stain to you, two of the blue stains are important and come in your exam. One, this stain, supravital stain, that is brilliant crescent blue or new methylene blue for reticulocyte. Another is Prussian blue stain which we do for liver or hemosiderin pigment. Correct? So these two, remember, these two can only be asked in your exams as a blue stain, right? Now, the normal retic count is 0.5 to 1.5%. The reticulocytosis is seen in hemolytic anemia, acute blood loss, or response to treatment in iron deficiency or B12 deficiency anemia, or decreased retic count is seen in aplastic anemia. Very important. Correct? Next. On the stain, students, the reticulocyte stains, can you see these RBCs which are there? Don't you think it looks like a golf ball, right? If some of you play golf, it characteristically looks like a golf ball. So these are called as the golf ball inclusions, and they are seen in 3 alpha gene deletions, that is alpha thalassemia, and these are called as the HBH inclusions. Correct? Next. Okay, one of my favorite images, students, which is very commonly asked in exams in 2022 also in INI-CET paper in November, this image was asked. This is the bone marrow needle, right? Now, 3 bone marrow needles are very popular: Sala's needle, Klima needle, and Jamshidi needle, right? So one thing which you have to remember is Sala's needle has a side screw. S for Sala, S for side, right? So this needle which you see with the side screw, this is the Sala's needle, right? In contrast, students, here I am showing you another needle. This needle can be used for bone marrow aspirate as well as biopsy. This is usually the Jamshidi's needle, right? So Sala's with a side screw. Jamshidi needle does not have a side screw, correct? Now, the other questions which can be asked from the bone marrow examination, the picture of needle can be asked. What is the, excuse me, most common site in adults? The answer is iliac crest or posterior superior iliac spine or anterior superior iliac spine. In children, if you have to do the bone marrow examination, usually done from the shin of tibia, correct? Then, what are the causes of dry tap on bone marrow aspirate, right? The causes of dry tap: aplastic anemia, myelofibrosis, hairy cell leukemia due to myelofibrosis, AML M7 again due to myelofibrosis. These are the causes. And in all these causes, whenever we have a dry tap on aspirate, we have to do a bone marrow biopsy. What is a dry tap? I am repeating again. Dry tap means when you aspirate and the needle is completely dry, it is called as a dry tap. Correct, easy? Very, very important. Remember, students, this image. Next. Another very popular thing, students, is the vacutainer, right? You must have seen that when a person comes to take your blood from a lab, he carries these tubes with him. The cap of these tubes is colored, right? The color coding usually indicates what is the kind of anticoagulant or substance which is present in these tubes, right? Now, red tube is plain, yellow tube has a gel, which is used for enzyme and serum studies. The lavender tube has got ADTA. It is used for peripheral smear or CBC or ESR by Winthrop's method. The green hurry tube, heparin, used for osmotic fragility and immunophenotyping. The pink tube is used for blood banking, and the blue tube carries citrate, right? And it is used for coagulation studies and ESR determination by Westergreen's method. Very important, right? Another tube which is left, students, is the one with a grey cap. This contains sodium fluoride, and that is why it can be used for blood glucose estimation, because sodium fluoride inhibits the enzyme enolase, right? Next, students, this image is also very important. This is an improved Newbar's chamber which which we use in our labs, right? Okay. These images are also asked. These are two pipette, students, which are used. This is the RBC pipette. R means RBC, red blood cell. So it has got a red bead inside. White blood cell has got a white bead inside. That is how I remember. Also, RBC count is more than WBC count, right? That is why when you see the markings, 0.5, 1 and 101, these are the markings of the RBC tube, whereas 0.5, 1 and 11, these are the markings of the WBC tube. Understood? Okay, so with this, students, I finish off with the important slides from the RBCs and some miscellaneous slides which can be asked in your exams. Thank you so much, everyone. At the end, I would just like to say, please do not waste your time. Focus grows, energy flows. So be focused, very focused, right? Work very hard, because there is no substitute for working hard, right? Thank you so much, students, and all the best. Happy studying.